Hello, guys. I'm Lisa.
And I'm Natassia.
And we were wondering,
are you free for coffee?
Welcome, guys.
Hello, guys. Welcome back.
So, on this last Wednesday in February, we want to discuss health. And you guys know that February is American Heart Month. And heart disease is still the number one killer of women.
Mm-hmm.
So, we kind of want to give a heads up for that. Heart disease is oftentimes masked in women. The symptoms that they tell you, the heavy chest, pain in your arm. Of course, you can have those symptoms, but you can have other symptoms too that you think are something else, like your jaw hurting or your back hurting or, things that really don't sound like a heart attack can be a heart attack.
Yes.
So those are things that you want to be aware of. If you just think something's off, you need to go get checked. And that's something that women tend to do, is
putting it off
and not wanting to bother anybody.
Yes.
Like I know someone that had a mini stroke on Thanksgiving. She didn't know it was, but something happened. And so she was telling me the story and I was like, did you call 911? Did your kids call 911? It's like, no. I finished Thanksgiving.
I finished cooking.
Yeah.
Oh my gosh.
I'm like, oh my gosh. So we do that.
We do.
Like, I don't want to bother anybody. It's too much trouble. I'm too busy.
Yeah.
So don't do that.
The forever running to-do list. Two that really shocked me, two that I did not know. Even as someone who's worked at a hospital and worked at a family practice in the past, were sweating and unusual fatigue. Well, how often are we just busy doing this, doing that? That list keeps rolling over to the next, stuff adds on, rolls to the next day. And you're just like, oh man, I'm tired. And you don't think of it as fatigue. You don't find it unusual because life
you're so busy.
You're
just tired.
You just think I'm just tired. And
nausea is
another one. Yes.
Yeah.
You know what? My mom had a friend. She thought that she had some type of acute food poisoning. She said, well, my stomach is not really hurt. Oh my God, but I'm just throwing up. I'm nauseous. I'm da 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 da. And she had a heart attack. And those were her signs. Her signs were that fatigue, that nausea, that vomiting. And, as someone who joins us weekly for coffee, we genuinely appreciate you all. And I do want to point out that I know some of these, I guess you would call them, some of these symptoms, it's kind of like, oh, well, how do you know when something is happening? But I really urge you to focus on self-care. Get into the doctor. Seriously, make that time.
Healthcare is self-care.
Yes, very much so.
A mani-pedi is fine, but you going to the doctor and getting
far
checked,
more important.
That is the ultimate self-care.
Yes. Taking some time off. I know one that I am trying to get better. I used to do this religiously. I mean, just all the time. I didn't care. The fucking sky could be falling. I'm taking my walk. That's how I used to be. Very, 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 I don't even want to say disciplined, because I was, but it didn't feel like a discipline. I just knew for me to feel relaxed, I had to take that walk.
You need to do that.
And as of lately, there's been a lot going on. And every day I tell my husband, oh my God, I need to go for a walk, or I need to do yoga. I need to go for a walk, or I need to do yoga. But I haven't done it. And those are the types of situations where you look up and you have mounting stress. You have, all these different things weighing on you, but you're not doing things that are good for your heart. Walking is really simple. You can listen to our podcast and walk.
You need no equipment.
That one's a really simple one. There's people that still walk the mall. Mm-hmm. There's people who in their buildings, they go down to the first floor and they walk, or, our building.
There's free videos on YouTube, walking videos that you can do in your house. Just walk and they're talking and they kind of show you scenery.
Yes.
And, so there's all kinds of things you can do if you feel like you don't have a good safe place to walk. True. And we want you to be safe.
Yes, we do.
So, if you don't feel safe at night, maybe, or you get off late or whatever the situation is, there's some great ones you can do in your home.
Yes, because it is imperative I just think of all of the women I know. I feel like they all care for somebody. Like,
oh, they do. We're nurturers.
That's
We are
everyone.
caretakers.
I can't think of anyone, even if it's their plants or their dogs or their cat or whatever it is. It is. I just had a class with a young lady who's 25, and it just seems so young because that's like 11 years ago, and just hearing her stuff, I was like, oh, this is so cute. Well, her biggest thing is her little sister. They have a big age gap, so her little sister is 15 and she's 25. But it's like just listening to that caring aspect. I'm like, even at this young age, you still have someone that you're like, I want to make sure this, and I jump on Snapchat so I can kind of see what she's up to. Every woman I know has someone that they care for, even as little as 4. Like, I think about our daughter and, oh, is he okay? Is brother okay? What happened to him? Oh, he hit his head, or, I mean, he's 2. And so, of course, they hit their head like once a day. It's just, you have to get past the trauma. But, even at that young, tender age, she's still concerned. Well, what happened? Well, is he okay? Does his head hurt? Well, he's crying. Is he sad? But we have to stop and care for ourselves, because if we're not there to care for those people, that a bit of that brings a little, heartache to you, but you can't do it if you're not there for yourself. That's just the reality.
And women of color, we have disproportionately disparities in healthcare.
Yes.
Be it access or, it's education, environmental, different things have an influence on our healthcare. So we definitely want to highlight that a little bit. Maternal morbidity and mortality, the babies even have higher numbers, greater morbidity,
risk of SIDS. Yes.
Breast and cervical cancer.
Yeah.
Even though we are finding it earlier, we still have poorer outcomes than other groups of women. So that's something. Sexually transmitted disease. Yeah. We're at the top of that list. Just overall, health and well-being. So that is something that we want y'all to, kind of note a little bit.
Yes. And so if you have friends who maybe don't look like you or even do look like you, encourage them. You look up sometimes and you really are that busy. You really are. My mom is an avid go to the doctor person. In no way, shape, or form a hypochondriac. She just, every year, this is when I go. So when COVID hit, they canceled her mammogram. Okay. We all were kind of waiting on this to dry up, so to speak. So they cancel it.
Not just hers, a lot of people.
A lot of people's
procedures got postponed. Yeah.
So we're having a conversation. Oh, I don't remember what month it was. I think it was ahead of her birthday. So I want to say perhaps around like July or so. Whenever it was hot in Texas. And y'all know that's 3/4 of the damn year. So that didn't help. But we're having a conversation. And I don't know why I remember this, but I said, Mom, they canceled your mammogram, remember? And she said, you're right. I didn't go last year, did I? I said, no. I said, remember they called and they wouldn't even reschedule. It was a cancellation. They were canceling all these people. But she always goes faithfully. Well, I just had this gut feeling. I'm like, you need to get checked. Like, you do this every year. And sure enough, breast cancer. And if she would have postponed much longer, they told her the outcome would be completely different. I mean, she started chemo within a week and a half, 2 weeks. Like, it's been a very aggressive treatment plan. But the reality is that's just how easily that can slip through the cracks.
Right.
It's not even always your fault.
Yeah.
Something happens. Hey, we're short-staffed today. Can we reschedule you? The days don't line up. And you just kind of forget the last time that you did it.
Get yourself checked and be like Tasha. Be that reminder to your friends and family.
Yes.
And hopefully someone will be that to you.
Yeah. And hold people's hands. If they have white coat, if this is just their thing where it's like, oh my gosh, offer to go with them, or maybe offer to go after, okay, we'll go get it done. We'll go to lunch.
Yes.
Give them something to look forward to, because it can literally save their life.
So the disparities with people of color, I wanted to give you guys a few tips. Just traditionally, women of color have had issues in the healthcare system.
Yes.
With being believed.
Yep.
Thought erroneously.
Yes.
That we have a higher tolerance for pain.
Yes.
That somehow our skin is thicker. We don't need as much anesthesia. We don't need as much XYZ. Just
care.
It's just bias.
Yes.
Based on no studies.
Right.
Nothing. They do these research type things and surveys with physicians, and based on nothing they have learned.
Right.
They erroneously believe these things.
Yes.
So we have that history. So I just want to give you a few tips on, if you are a woman of color, how to kind of take control of that, because it is kind of scary. And the number one is advocate. Yes. If you cannot be an advocate for yourself, take somebody with you. Like Tasha was saying, a lot of us do have white coat syndrome, and I do. My blood pressure kind of goes up, and some of it, you've been driving and stressed, and I need to get there on time, and that whole thing. And then some of it is just that authoritarian person in a white coat, and we've all had experiences with physicians and people in authority that have not been exemplary.
Yeah.
Like
true.
This is, it just didn't go the way we thought it would. So if you're nervous, you think you won't get all the information down, take someone with you that's not afraid to advocate for you, and that will write down the information, get the, ask the right questions. Yes. So that's one. And track your own data.
Yes.
When they weigh you, when they get your temperature,
yes,
when you get your scans and mammograms and pap smears and all that, get that information.
Yes.
So that should you need to go somewhere else, you have that.
Yes.
You have that. So keep up with that. Trust your body and your instincts.
Yes,
if you feel like something is wrong, you go to the doctor. And if that doctor doesn't believe you,
go to the next.
Or can't find something, you keep going.
Yes.
And until you find someone who will.
Who is listening to you and is working to solve the problem that you're telling them, hey, this XYZ is going on.
Yes. You have your instincts and your feelings for a reason.
Yes.
And if just in your gut, it might not even be a physical thing.
Absolutely.
You might not be in pain. You might
just
not
know something is off.
You don't feel a lump, but you just know something is not right. Trust that.
Yes.
Trust that feeling. And then fourthly, know your family medical history.
Oh, yeah.
That's very important. Know, who in your family died from heart disease, if there were any cancers, that some of those are genetic.
And be a part of your family medical history. If you look back and you find it's really difficult to find this information, then you be that change. Yes. You make sure you're going in, you are being seen, there's some level of documentation, because for women of color especially, it can be very difficult to find that information. It can be so difficult. Things were maybe called something different back then. You weren't able to be seen by certain doctors. And just to put this in perspective, because I think sometimes the idea is that we're talking a long time ago, and we're not. My dad's birthday was a few days ago, and my grandma was depression. She was an adult during the Depression, a young adult, was married around then. And so when my dad was born, funny fact, she doesn't like holiday babies. It's like her only superstition. So she put herself on bed rest. My dad's number 6. So at this point, you kind of know what you're doing. She put herself on bed rest because she didn't want him born on Valentine's Day, which she did not believe in celebrating for whatever reason. And when she went in, the doctor would not see her because he blatantly told her that she fraternized with N-words. because she had neighbors across the street from Spain. She had a neighbor who is still living to this day, who lived about 3 doors down across the street. And she was very kind to the husband when he was dying. And they said, we're not going to serve you. So my dad was born like a few blocks away at a retired physician's house because there was nowhere, no one would take her. Now, this is a white woman.
Sad.
This is, I mean, just as white could be. But because she associated with African American people, they wouldn't even see her. This is not stuff a long time ago.
Yeah, yes.
I was just telling Lisa, now my daughter's 4. This is not something y'all hadn't heard. Y'all probably know all about my kids. I went in. It's our first pregnancy, our first baby. We're newlyweds. I just told Lisa this like a couple days ago. And the OBGYN blatantly tells me that I am Black and I'm overweight. I'm not going to have an easy pregnancy. This is going to be very difficult for you. And you're most likely going to have a C-section. This is my first visit, y'all. I went to state for wrestling. I was the first female wrestler in Dallas Independent School District. I hike all the time. I like to ride bicycles. I walk. And when I say walk, like I used to walk 7 miles a day. Like that was my jam. That's my weird thing is. And so I'm thinking to myself, I'm not the smallest girl, but I'm not the biggest girl, but I'm pretty damn healthy. Like I take the stairs at work. I walk.
Before she knew you.
Yes.
Really? Or knew your history, had talked to you.
No,
yes.
Yeah. She was like,
just
you're
straight
Black.
Up. I've already made a decision.
Yes, you're Black. You weigh 218 pounds. You're going to have a C-section. And because of my background, my medical background, I had seen C-sections. They should be used for emergencies, at least for myself. That was my belief. I did not want to be just prescribed this just based on the fact that I'm Black and bigger than you like.
And you looking at me before an exam. You're just looking at me,
guys,
and you've already made that decision.
My pants are on. My clothes are fully on. I'm still wearing work shoes. I'm not even laying down flat. There's no goop on my tummy. That's it. And my husband he was disgusted. He was mortified. I think honestly, if we weren't so excited to see the baby, we would have left then. Like he is not about that life. He would not stand for that. But that was 4 years ago.
Yeah. And well, the reason Tasha is telling the story, the reason she told me this story is because I was telling her that I had my yearly exam this past week. And I'm a woman of a certain age, so I have gone through menopause. So my feeling, just like when I had my babies, I wanted a physician that had a baby.
Right.
You kind of want someone to help you navigate this new territory.
This new norm. Yeah.
So when I was going through menopause, I wanted someone that had been there, at least perimenopausal, that kind of had an idea what this was. So I chose an older gynecologist, an older woman gynecologist. This is my second time to go to her. So I go in, and it's not the most
inviting.
Right. The nurse comes in and does all the preliminary stuff. So, you're undressed, sitting on the table, butt naked, waiting on the doctor. You know how that is. So she comes in, and the first thing she says, I love your hair, and touches my hair. And it was so off-putting. Of course, I had the mask on, so she couldn't see that my mouth was open, And I just was so shocked. Like, who does that?
Right.
And so
I'm not a puppy.
We went.
Please don't pet me.
Yeah, we went on, and just a couple other things she did, but that was the main one.
That set the tone.
It set the tone. Yeah. So the whole time during the exam, I'm thinking, I need to find someone else.
Yes.
Because I thought it was so disrespectful.
Yeah.
Given my age and hers.
Yeah, I know. You're not even a kid.
Right. Like it's almost
and not that that's okay.
Right. But almost like if it had been a younger woman, if I had been a younger woman,
right,
I still would have been offended, but I would have been less so because she was older.
She would have been like a mother age.
Yes. Yeah. So it just crawled all over me.
I tell you, a little bit of that gravy run all over my plate. Yes. I don't like that.
So, if you are a Black woman, if you are a woman of color, these are issues that we deal with on the daily
basis.
When you,
yes,
in the medical profession.
Yes.
Just getting basic, your yearly, your mammogram, your whatever. This is what we're having to deal with. And
this is what discourages people.
It is.
I have one more short example that it hit me when you said that. So I had postpartum preeclampsia with my first child. I went home. I was perfectly normal, perfectly fine, and it just snuck up on me. And it was very bad. I stayed in the hospital for days. They struggled. I was given all kinds of medication because they just couldn't get it down. So at that point, my husband was team one and done. We're not doing any more of this baby stuff. Like, his dreams of 4 kids, they ended that day. He was like, no. I mean, he was just very, very scarred from the whole situation. And there was some mistreatment there, which I'm not going to get into because I want to go to my second child. So obviously he got over that. And so then we have our second child. And the deal I made with my mother-in-law, with my parents, with everybody, if my blood pressure goes up, even in the slightest, I'm going to the hospital, right? I'm not going to let it get as bad as it did last time and think, oh, this is just going to go away. Even though it was a very horrific experience with me, and that is where my white coat syndrome started with some of the treatment that happened, I said, I'm going to do it. So I'm taking my blood pressure and it's going up. It's just inching up. And I'm like, oh, man. So I said, you know what? You made a deal. You now have 2 kids that really need you. So get your crap, go to the hospital. So I had pumped a little milk. I had even got some formula. I didn't know how long I was going to be gone. Again, this last time, it was like I was in there for like a week. And so the previous time. So I go in and the young lady who helps me, she had given birth also at a birthing center. We're bonding over that. And she seemed uncomfortable when the physician came in. And I wasn't uncomfortable. It was a Black woman. I was really actually excited. I thought, okay, good, we can level. And to fast forward the story a bit, she wanted it put in my medical charts that I had been self-medicating. You all do not understand. If you've ever pushed out a baby with no medicine, you may feel my pain just a little bit, but you don't know how fast I sat up in that bed. And I said, no, that will not be typed in my medical records. Where is that coming from? And she looked at me. And when I say looked at me, I do mean look down on me. And I could feel that she was looking down on me. And she was like, you know, self-medicating is so dangerous. And just because you had labetalol, which is a blood pressure medicine, guys, does not mean that you should have been taking this and you could have. I said, let me stop you right there. Let me interrupt you because everything you were saying is not just a miscommunication. It's a blatant lie. And it will not be put in my medical records. I was told by my midwife to take this at this time, to take it at that time. We went over the dosage. We went over how much I weighed. All of this was communicated between the 2 of us. And I am following their medical record. The same people who helped me get this baby out of my body, that's whose advice I am following.
Yeah.
And I came here because I wanted to be safe. But I did not self-medicate. Well, I just know it's very popular. I do not care about what is popular at all. I did not self-medicate, and I will not let that be put in my medical charts. Now, I'm happy to turn over my records to show you what they told me to do, but I didn't self-medicate. And so she backed down. Spoiler alert, she went to do a C-section on a mom who didn't want a C-section because she was about to go to lunch. Y'all, I'm not going to even preach that sermon today, but just know she looked dead at the young lady I believe she was a nurse, but she had another title, who was helping. And she said, well, I need to finish this C-section because I am going to take my lunch today. So that's where she went. But my husband, when she walked out, my husband got up, he closed the door and he looked at me. He's like, I am so fucking proud of you. And the nurse was like, yeah, I can't say much, but that was bullshit. And she was like, and I'm not putting that in there and I'll make sure it doesn't get put in. So you almost got to kind of be nasty nice with it. I mean, I wasn't nice in that moment, guys, because I had just pushed out a baby and how dare you?
Yeah.
How dare you tell me I'm self-medicating?
But we're consumers in everything else.
If
you're buying a car battery, a sofa, a washing machine, you will research, you will read consumer reports, you're going to ask your neighbors and your friends, do you have vacuum cleaner? Do you have a whatever?
Yeah.
You'll do your research.
What's your favorite XYZ?
When it comes to physicians, we just kind of go. If they're at the hospital, like, you're okay.
Okay. So, as opposed to shopping around.
Right.
And that was kind of this instance, guys. I do want to point out that I didn't have a lot of choice in this. I mean, she came into the room, she was the physician, there we go. But at the same time, I just definitely felt like this is not okay. Like,
yeah.
And she just blatantly accused me. Now, she never asked, guys. As a matter of fact, she asked me, had I done anything? Because, of course, they're giving you medicine. They want to know. And I told them, I said, I took labetalol at this time. This is what I took. And I took labetalol at this time. This is what I'm telling them everything down to, I even had some green tea driving over here. I'm being so forthcoming. Yeah. And it's just like, why would you do that?
So do your research is what we're saying. If
that you can be
where
prepared.
You're going to is not a good fit for you, find someone who is.
Else. Yes.
Find someone who is.
And guys, I want to tell you this. As someone who worked at a hospital, I'm going to tell you what no one wants. No one wants you to know, but they can't do nothing to me. I don't work there anymore. Walk the hell out. And I said it. There have been lives that have been saved because no one would listen to them. And now you're admitted and you get really scared. Like, what happens if I walk out? Walk
Nothing.
The hell out. You leave.
And live to tell another day,
baby. You go somewhere else. That is perfectly fine.
If you're not being listened to,
yes.
If you are being disrespected,
yes.
If you just feel that, for whatever reason, they're not a good fit for you.
No, my needs are not being met.
They might be lovely people. Just like you date people, they're lovely people. You're just not for me.
They're just not for you. That's it.
So leave.
Yes.
And also with, lately in the news, there's been plastic surgeries and Brazilian butt lifts and different things that people are doing and have lived to regret.
Yes.
And we just want you guys to be cautious. We're not saying don't do it. If that's do you, boo. If that's what you want. I just want you to do
Make
your
an
research.
Informed decision.
I want you to go to somebody who is board qualified and knows what the hell they're doing.
Yes.
I want you to know, just like when they advertise all these drugs on TV, after the little spiel, they tell you all that can go wrong.
Could cause death.
Yes.
Like, wait a minute.
There's some stuff that can happen.
Yeah.
And we just want you guys to be aware of that. So the Brazilian butt lift, it's kind of two things. They liposuction fat from somewhere and then put it in your behind. The problem with that is that sometimes, and I have it's 2 out of every 6,000, which is pretty good odds. I would play the lottery if it was those odds.
I agree.
This happens where the fat can go to your heart, or your lungs, and which is a problem. It's a problem. So there's blood clots. You can have a heart attack. Different things.
Yeah.
So be a really good consumer if you want to do this. Do your research. Research the hell out of the doctor you're considering.
And you know what? Check hashtags. This is going to sound kind of silly. Check hashtags. A lot of people in their excitement, they'll hashtag a doctor. They'll tag a doctor at the beginning of their journey. Reach out to them.
Yes.
A lot, again, consumers. Remember, none of this is free. Okay.
Right.
This is all.
You're a customer.
You're a customer.
You need to be treated.
And medical is big money.
Right.
That's big money.
You need to be treated respectfully, and you need someone who is qualified to work on your body.
And find out, what is aftercare like? A lot of people are really good at getting you in the door. They're really good at making you look good. But what about that aftercare? What's happening, 3 months down the line, 6 months down the line? Something isn't feeling right. Something isn't sitting right. What do? Are you versed in what happens if something goes awry? Then what does this next procedure look like? Is that covered by this? What type of maintenance is covered? I think the whole point of this is take ownership of your health to the best of your ability and be informed. As long as you're informed.
Do your research.
Yes, do your research. People cannot.
I hate to say that. You can't trust it in everybody.
No, it's because it's to sell money.
Yes.
Because it's to make money. It's to make a sale. At the end of the day, That's what it is.
And if you're a person of color, you even less so.
Right.
Everybody.
Right.
All of our friends out there, I'm talking to everybody, no matter what color you are.
Yeah.
If you are a woman of color, even more so.
Because unfortunately, there are early implanted misconceptions about children of color, women of color, men of color. I worked at a children's hospital, and you can look up some of her information. I think she's absolutely brilliant. I had the pleasure of working with Dr. Dawn Johnson, and she was really who helped me finalize that I would not give birth at a hospital. Now, this is a woman who makes her living at a hospital, but, she just helped point out. I told her about the visit. I was really upset. And she had me go in her office. I just broke down crying. I said, I know that I'm big. And she's like, no, stop. She's like, you take the stairs every day. You eat vegetables every day. Like, did they ask you any of this? And I'm like, no, she wouldn't ask me anything. And I'm trying to tell her. And she told me, she said, there are just these misconceptions that happen. And trust me, most medical staff, they get tune-ups on various aspects of their education, their skills, their talent. And one of them is social and cultural acceptance, social and cultural diversity. But if you've ever been to one of these little 2-day or 2-hour trainings, it takes a lot more than that to uproot these early implanted biases. Mm-hmm. And so you have to be the one that stands there and says, no. Like, no, that's not the case. Or no, that is not true. Or I'm going to do a little more. I have no problem telling a physician, I'm going to do more research. You are a doctor of
It's
many.
your body.
It's my body.
And you only get one.
That's it.
So you have to advocate for yourself.
Yes.
And if there's some people that are just, for whatever reason, they're shy. They just don't feel like they can do it. Find someone who can.
Yep.
If you have a sister,
you have a Natasha or a Lisa in your life.
Yes, somebody does. And they will take notes. They will ask the questions.
Yes.
Most every physician's office allows you one person, even with COVID.
Yes.
Allows you one person to go with your visit. If you need to take somebody, take somebody.
And if you have to tell them, for a fear of me not understanding, I need to bring this person.
I might forget something.
They have to allow that person legally. So FYI, that's your little wink, wink, for fear of me not understanding or not being able to grasp what you're saying. And they have to allow that person and take them with you unapologetically, because it's your body and you really do know best.
Yes. Other thing we wanted to tell y'all, I know you've read about Linda Evangelista, who was a supermodel, and she had a cool sculpting procedure, and she had a side effect from it, which is, I can't pronounce it, but it's PAH, which is the cool sculpting. It freezes the fat in some kind of way. Your body gets rid of it. But for some people, the tissue thickens and hardens, and that's what happened to her.
That's what happened.
That's the other procedure. Those were two. There's lots of plastic surgery type procedures that women are doing, and I'm not judging you in any way. If you want to do it, if you feel like you need to do it, do it. I'm just wanting you to be informed. I want you to do your research and find qualified physicians and know your risk.
The worst case, know your risk.
Know your risk. People die get a tonsillectomy.
Yes, they do.
It just, if it's.
And she was very influential. I mean, 700 magazine covers.
Yes. If it's a medical procedure, there are pros and cons for every single one. So I just want you to do your research and know. So these are some things that could go wrong. We're not saying this to scare you. We're saying this to inform you and to keep you safe. If you want to do it, know the risk, find the right person to do it, and do your research.
Yes.
And be healthy, you guys. Healthcare is self-care.
Yes.
So this is your month to go. I do that. I take a month, and February is my month, and I do all my stuff, my, mammogram, your yearly, your, your primary person, your bone density, all this stuff, the dentist, everybody in a month. And then that way, it's all together.
It's all covered. Yeah.
And so, this is a good time. Please take care of yourself.
Absolutely.
So now on to lighter things.
Yes.
We're doing our Sexiest Man Alive this week.
Mine's a repeat. So who do you have?
I am going to go with Sam Elliott. Now, he's an oldie but goodie.
You're pulling some good ones.
But he has a new show, you guys. You Yellowstone fans.
Oh, yeah.
There's a prequel that's on that my mom and I are hooked on. I think it's 1883.
It is 1883.
Okay. I get the year mixed up sometimes. But it's a Western, which is really not my jam.
Oh, I love Westerns.
But it's so good, you guys. So good. And he's just held up so well. And his character is really cool. He looks the same.
To me, this man looks the same from the day I was born till now. Yeah.
So he's just so cute and on a horse, and he just does it for me.
It's probably he's had this mustache forever. Like at this point, I don't know if this thing is real, fake, but I
think it's real.
That's he's had it forever, and it's part of who he is.
And he's married to Catherine Ross.
Correct, Catherine Ross.
Which look her up. If you see her, you'll recognize her.
And they've been together forever.
Forever. They have a ranch in Malibu.
I didn't know that.
Like, how cool is that on the beach?
Yeah, they have been together forever. A very, very long time.
So that's my guy this week. That's my crush.
Okay. So mine, I'm just going back to Dr. Mike. But he's
a cutie.
First off, he's hot. But outside of that part, your health is your wealth. And he is a strong advocate for that. He's a very strong advocate for knowing your body, keeping track of your own, anything you're experiencing. He's really big on advocating for yourself.
I love all the information he puts out.
Yes. And he
really is good at educating us.
He is. He is an amazing educator. Mm-hmm. I really think maybe more than being a doctor, that's kind of his calling, because he does have a way about him where you're listening. You're like, oh, this is really good. This is really good information. And he puts it in ways where you can easily understand it. So that even though I've picked him before, he's just on par.
He is.
And he's good to look at. Yeah. So
we'll do him twice.
He could be twice.
Yeah.
He definitely could be twice. So that is my Sexiest Man Alive this week. And we'll definitely tag Dr. Mike, because I think he is a great one to follow and kind of get.
And if there's some articles or some information that we can share with you, we'll post it.
We'll post it for
but
sure.
Just, we love you guys. We want you to take care of yourself.
Yes.
Email us if you have any questions or if there's anything that we can help you with. We'd love to. We are not physicians. We are not medical people.
No.
We just want to point you in the right direction.
Yeah.
And if we can do that, we'd be happy to.
Yes, absolutely. Absolutely.
But take care of yourself. We need you.
Till next time.